Mission to Margin is the business of healthcare.
Every male on my dad's side of the family has had diabetes, and even though I was an athlete, top performing athlete in the military, I was actually starting to show signs of diabetes, and so I wanted to get into healthcare to see if I could first of all learn more and hopefully impact people's lives. My grandmother essentially just fell apart, right? Grandmother has no legs. So, it was just so natural, to grow up with that. I don't want anybody to have to experience that.
There was a top 5 pharma company. They had an opportunity to launch a product. In fact, they brought the product to market, and they were not seeing the new prescription share that they wanted. In fact, it was flattening out. And as everyone knows, if you don't drive that new NRX share line in the first 6 months, it's extremely hard to break that trend. So we worked with them to determine what were the proficiency levels of their team in some specific areas around consultative dialogue, clinical selling skills, and happy to report that there was a trend break in the NRX share, and in fact they had to go back to upper management and increase their forecast for the year.
Empathy for the patient, helping providers improve efficiency, adjusting to new buying paradigms. The work and competencies of a sales representative is undergoing just as radical change as that of other healthcare stakeholders. Do we even need salespeople in healthcare? Is the portion of healthcare dollars spent on sales wasteful or productive? We're joined today by 2 experts to explore the value of sales in healthcare. We look at how the best suppliers ensure sales adds value, and we also ask how healthcare leaders, health system CEOs, physician leaders, and so on, can get the most value from these passionate contributors. Jay Graves is Vice President of Sales for the U.S. Roche Diabetes Care Division, leading all field sales and sales operations. Prior to joining Roche in 2006, Jay was an intelligence officer in the U.S. Army leading global deployments in Central America, the Caribbean, South Korea, and Iraq. A native of Raleigh, North Carolina, Jay earned a bachelor's degree in political science and military science from North Carolina State University and an MBA at the University of North Carolina at Chapel Hill. Brad Ansley began his career as a bench microbiologist and then moved into pharma sales and marketing. He successfully launched 12 new products during his work with Merck. Brad's passion for bringing better solutions to patients led him to work on sales process and ultimately to his current role at Sales Performance International. He leads SPI Health, the global sales consulting delivery platform for life sciences companies. Through this work, he has become expert in transforming sales process and results to maximize shareholder and societal value. Jay Graves, Brad Ansley, thank you so much for joining the business of healthcare today.
Glad to be here.
Jay, tell me a little bit about the work that you do.
Yeah, so I lead the sales organization for Roche Diabetes Care here in the United States. So I have responsibility for all of the different field teams, HCP, healthcare provider teams, channel teams, retail, as well as our operations and training teams in-house.
And you come to Roche from a military service.
I was an intelligence officer, which a lot of times people will say is an oxymoron. I won't debate them. But I came from the military, spent time overseas, all over the world, South America, places in Europe, Middle East, and Asia, and decided that I wanted to leave the military and specifically, as I was looking at my options, get into healthcare. And the reason why is because every male on my dad's side of the family has had diabetes, and even though I was an athlete, top performing athlete in the military, I was actually starting to show signs of diabetes, and so I wanted to get into healthcare to see if I could first of all learn more and hopefully impact people's lives.
So, do you have diabetes? Are you pre-diabetic?
I do have diabetes. Yeah. Unfortunately, I'm not the athlete.
Yeah.
So, that was. But yeah, I ended up being diagnosed with diabetes. But being educated about it, I'm well in control. And actually, my father, who was going blind at the time, worked with him, and he's kind of halted where he's at today.
That's amazing. So you work in a business that is intimately important in your day-to-day survival.
Very much. I live it. Yes, every day. Brad,
tell me about the work that you do.
Sure. I'm the director of SPI Health, and SPI Health is Sales Performance International's dedicated life sciences practice. So we work with the world's leading pharmaceutical, medical device, companies that sell into the healthcare marketplace.
So once a healthcare organization, a pharma or device company engages you, what are the three most important things that you do for them?
Yeah, first is help them determine what's the best sales strategy for them, right? There are several ways you can go there, and each one has an impact on the competencies to which you train. So we help them understand what the right and what the best sales strategy is. In conjunction with, there's a lot of good thought process out there, so in conjunction with them, working with them to determine what the right one is. Then, in today's world, especially in pharma, there hasn't been a lot of focus on sales process. There's been a lot of focus on call models, but not sales process. And as we move into an era that's changing in healthcare, it's a shift towards this business-to-business selling model that really hasn't been there in pharma. We've seen it in med device and in capital medical equipment, but in pharma, it's a little bit of a different story. So then we help them develop that buyer-aligned, patient-focused sales process that is executable by each sales representative on a consistent basis. And then thirdly is to really assess and understand what competencies are needed to do that and close those gaps.
And I know another interesting thing that you've explored is the use of Lean and Six Sigma as part of your practices.
Because you see this consolidation right now that's happening with healthcare providers being, absorbed essentially by health networks. And, as you look at that complexity, there's a lot of inefficiencies in that. And one of the things that I want my reps to be able to do is to recognize those inefficiencies, because we have certain tools that can help in those cases. To do that, they need to be trained on what to look for. What are the barriers? Where are the choke points? Where's data, not making its way efficiently to where it needs to be. Just sort of those different ways of thinking. And so that's what we're infusing in our training now for all new hires and our existing team.
One of your team members who helped an organization eliminate unnecessary work in moving data around. Can you just share that story a little bit?
Sure, yeah. The rep looked at how this large organization operated from a data perspective, particularly around diabetes, and they noticed several inefficiencies. And one of them was that they had 2 nurses, full-time FTE nurses, that were doing nothing but scanning PDFs into medical records. And it was very costly for that organization. And so by applying our lean thinking, they were able to digitize everything, for that facility. And so they no longer needed the headcount for that. And so they were able to reduce by 2 FTE in their organization.
Well, I see that as really understanding how the organization worked, right? In today's marketplace, where everything's an account now, there are very few individual stakeholders. You really do have to understand and have that, what I like to call situational fluency, to understand how business flows throughout the organization. It sounds like that's exactly what they did.
Yeah.
How do you find those competencies? How do you know what are the competencies you need for situational fluency?
Look at it from an assessment perspective, where you develop a competency skyline of competencies that are needed for a particular type of sale, whether it be pharma, med device, whatever the case may be. And then you test those competencies, you assess for those competencies, because you're also setting a proficiency level that you need for those competencies. Then you go out and you assess the organization, the sales organization, on those competencies versus the proficiency level, right? And a typical way of doing that is with a performance development platform, where you can just serve up, once you get the assessment back and understand the gaps, then you can then serve up performance development plans that help continually increase and drive proficiency for those competencies that were found to be low or below the standard that the organization set to achieve that. Now, understanding specifically which competencies are needed for situational fluency really revolve around understanding how to deliver a consultative dialogue. In today's world, a lot of times what we're seeing is organizations still have an old methodology in place where it's features, functions, benefits, as opposed to having a conversation that begins to understand from the customer's perspective what they're trying to achieve, what outcomes they're looking for with their patients, and then beginning to, I like to call it, be insanely curious as to how can you help them achieve their goals.
This isn't your dad's Xerox sales
No,
manual.
That's exactly right. That's right. It's not about feature, function, benefit anymore.
Give me an example of an organization or a situation where that competency model made a difference.
Let's look. There was a top 5 pharma company. They had an opportunity to launch a product. In fact, they brought the product to market, and they were not seeing the new prescription share that they wanted. In fact, it was flattening out. And as everyone knows, if you don't drive that new NRX share line in the first 6 months, it's extremely hard to break that trend. So we worked with them to determine what were the proficiency levels of their team in some specific areas around consultative dialogue, clinical selling skills. So what we found was they were still selling product, not trying to understand how this product could fit in to that system. Like you were saying, how does this fit into your treatment algorithm across your organization? And how does it benefit you and others? And it's also understanding who else in the organization it might impact, right? So understanding how that impacts them, and then being able, in today's world with evidence-based medicine being such a big part of it, then being able to prove credibly that your solution will do what you say it does. So we're really focused on those 2 areas, and happy to report that there was a trend break in the NRX share, and in fact they had to go back to upper management and increase their forecast for the year.
But that's really interesting to me, because as a sales leader, then I would imagine that I'd be able to tailor my approach to my individual rep. So if you find that their proficiency is here and you need to take them here, then we can do that.
Right.
If they need to go from here to here, then we can customize that as well.
Yeah.
To get instead of trying to put a blanket on them, on everybody, and say, okay, this is just standardized training for everybody, and that's it.
That's right.
Good luck.
Right. Yeah, and in today's world, I think what we're getting to is using this adaptive design, if you will, so that as we understand where someone is on the spectrum of competency or proficiency for a particular competency, then we can begin to serve up specific training as needed and as they consume it, that may be different from another representative over on the other side of the organization.
So healthcare's gone through pretty dramatic change. Looking back maybe 5 years ago to today, what is dramatically different?
Wow. So the financial landscape certainly changed with the Affordable Care Act. There was a provision in there for diabetes that it took about $1 billion out of our industry in reimbursement, and so we really had to shape all of our strategies, how we were going to approach the market. At the same time, not just from a financial perspective, but also the market at the time was changing, because we were starting to see more and more of that consolidation happening. So, whereas when I started and I called on, Dr. Banks in Zebulon, North Carolina, and he could make his own decisions. Right. Now he's an employee, and he works for a system. And so that was going on at the same time that we were kind of going through this turmoil from a financial reimbursement perspective. So within, I would say, probably between the last 5 years, we've seen some pretty major shifts to how we have to approach the market.
And that's what I see, that change, shifting from that single stakeholder decision maker to the multi-stakeholder decision maker, the value analysis committees,
Yep.
is really driving that shift, as we were talking earlier, to that B2B type selling model, right? So because you're really looking at having to understand, at one point, a sales representative may be talking to a clinician. Mm-hmm. Another point, they may be talking to an administrator that's more financially driven. So it's really understanding that all the way across the organization.
And you have to be flexible and agile enough to be able to do that, particularly maybe even in the same office the same day. If you go way back to when I was a rep, it really was the features and benefits. That's what I was trained on. Build the relationship, get the message in there. Hopefully you can get to the third message. It was all about, how many messages you could deliver and leave your samples and move on. Whereas as today, you have to have that ability to be able to speak more B2B. Whereas back then, B2B was more your channel team or your managed care team, right, or senior people in the organization. Today, that needs to be your frontline rep.
Everything's an account now.
Absolutely.
Right.
What changed that caused $1 billion to come out of the diabetes industry in Obamacare?
It was a reduction in Medicare reimbursement.
So was it a change in how much was paid per CPT code or
Yes,
DRG?
it was, yeah, significant.
Interesting. And what did that do to outcomes? What did that do to patients?
Unfortunately, we saw a mortality rate increase after that decision, and the reason being is because it allowed a lot of products into the system that are not necessarily as high quality as you would get from some of the branded organizations. And so in something like diabetes, you're treating yourself, off of your blood sugar number a lot of times. And so if you don't have the right reading, you can make some serious mistakes there. And so there was a study that came out afterward, and some of the organizations that deal with diabetes, also discussed it, that the mortality rate was increasing, which was really, really tough to see.
What drives the passion in your day?
Well, some of it goes back to the fact that, my family history and just watching, some of the my grandmother essentially just fell apart, right? Grandmother has no legs. So, it was just so natural, to grow up with that. I don't want anybody to have to experience that. And so, one of the things that I instill in me every day, and actually in my reps as well, is that empathy for the patient, to make sure that we're doing absolutely everything that we can. The business comes with that, but keeping the patient at the center of what you're doing from a motivation perspective, in my opinion, those nasty rainy days when you might, hey, I'm going to be on the lower end of my call number. You're not, because you have a few more lives that you need to interact with out there. So that's what drives me.
As you're doing your work, how does passion fit into that?
It drives what I do. I came up in the same environment. So I was in the pharma industry for 22 years. And I went to work every day because I knew what I was doing saved lives. And now it's the same passion. I just get to take the experience that I've had and help others do the same thing, and help others have the same type of passion, and understand that they're not just selling a pill, or they're not just selling a device. They're selling something that can change somebody's life. And the better they do it, and the better they help their customers do that, then the better off the health system will be, the better off the patients will be. It drives pretty much everything we do, is knowing that ultimately we're helping sales organizations do what they do better, which is get the information about their product out in a manner that shows a solution and produces an outcome for their customer.
Is passion a competency?
I don't think passion is a measurable competency, right? It's more of an attitude, I think, or a personality trait, perhaps.
Yeah.
Right. I don't think I'd classify it as a competency.
Yeah, I would say it's not a competency, and that's one of the areas that I look for when I'm hiring individuals. Is you can tell that passion. There's a story. There's something that is driving them to be, above and beyond. They're the ones that are going to do their own research. They're the ones that are going to continuously learn. They're always forging ahead. And it comes from that passion, call it grit, call it will, skill, all of that, but really it boils down to their passion. Why are they there? Why are they getting up every day? If it's to make a paycheck, you can tell that. If it's to make a paycheck and save lives, you can tell that too. So,
interesting. What percentage do you think of a sales team in general, not necessarily yours, but just in a sales team, what percentage do you think would be someone you would call passionate?
That's a great question. I would say if I'm a sales leader and I look at that, top 10%, 12% of my sales organization, you're going to find some consistencies there around passion, drive, accountability, pretty consistently through that group.
We call that group of people in our vernacular. We talk about those as eagle sellers, right?
Yeah.
And if you go ask them how they sell, and ask them to put that process out on a piece of paper, they go, I don't know. I just do it. I just do it. And so one of the things when I talked earlier about putting a consistent, repeatable sales process in place is so that those others that we call journeymen, not a bad place to be, all good people, all good sellers, they perhaps just don't have that innate sense of what drives that passion and that process, right? So to be able to codify that and put it into this buyer aligned setup that others can follow is one of the things that we like to help instill in sales organizations.
In a way, you can't fix passion,
No.
right? It's either present or it's absence.
Right.
You can enhance it with competencies and elevating proficiency.
Absolutely.
Right.
Yep. I would agree with that.
So what is it, if I'm a large payer, a large employer, CEO of a health system, I know that a portion of the dollars that I'm spending in my supply chain are paying for sales. Why do I need sales?
It's a great question. I would argue that the salesperson is an expert, needs to be an expert in what they do. And so you need somebody during that process to understand, what is that employer trying to accomplish? Is it sick days? Is it lower ER visits? Whatever that is, you need to have somebody there that understands how to take that information back. And that's going to be your salesperson to deliver to your employer exactly what it is you need. Without that, where are you going to go? Who are you going to go to?
Who's going to perform that
Right.
work?
Right, and I think in today's marketplace, you can think about physicians or you can think about employers, whatever the case may be. The way they want to consume information is continually expanding, right? There are multiple different ways to communicate, and I'll use physicians as a specific example. What studies are showing today is that they want to be able to communicate either. Some want to communicate by inbound calls. They want to call when they need something. Others want that sales representative to come have a conversation with them. Others want to be able to go to a website, and some like the opportunity to do all three. So, from having a sales representative perspective and why have that sales representative, I think they are part of the whole cadre of communication vehicles that buyers and customers are actually looking for. So they are part of that constellation.
I think that makes an enormous amount of sense. The flow of coming into a sales organization and discovering what you've got, how long does it take to assess a sales organization and decide if you've got 60 FTEs, who are your Eagles,
sellers, yeah.
your journeymen, and I'm suppose there's a third category, perhaps your GE, what was the GE's term, your bottom of the stack, inevitably in all
You're always
organizations.
gonna have something.
Yeah. How long does it take to assess that?
Well, let's talk about competencies, assessing competencies specifically, right? So that can actually take place relatively rapidly once you understand what competencies you're driving for, and make sure you have a sound sales competency model and the proficiency levels. The assessment, again, if you have a solid performance development platform, the assessments can go out and be returned and analyzed within a month, right? And you can begin to look at dashboards for where your organization sits. And the real key is then, I think the other question is, okay, then how long does it take once you understand that to close those gaps? And I think that's the secret to it all, is then how do you do that? Are you able to then, on a relatively autonomous basis, be able to send out those performance development plans so that the sales representative understands their path to excellence, and that a manager can then monitor their path. So the manager doesn't necessarily have to say, here are the steps I want you to take. They've already got that, right? All they have to do is monitor that and then begin to have those deeper discussions about, okay, you were able to take care of this and you completed these tasks. Let's talk through those, right? So I think the bigger question is assessment and understanding the gaps can be, a 4 to 6 week process. Probably even less than that if pushed. But then the development time really should be something that's continuous and that continues to drive proficiency over time. So you may have 4 levels of proficiency from, basic to proficient, advanced, and expert. And really there are those proficiencies that you'll want to continue to drive. So that you want to have a path to excellence for each of those competencies.
And that's one part of it. I think that your question it's an interesting question because it involves multiple people. So, if you have a new sales rep in my organization, they've passed a certain amount of behavior that we're looking for, and, transferable skill and all of that, right? And so, you can assess them through the training process. Are they getting the same scores that your top people historically have gotten? And there's certain things you can do there. Some organizations will go straight to the numbers. Okay, are they hitting their number or not? You have to be careful in that sometimes because, to me, that's where I start looking at the holistic person and also their manager and also their director. Like, what are we doing for this individual? Have we done everything? Have we, got them from here to here using your plan, and if so, then you have to maybe make some decisions. If you haven't given them that opportunity, you need to give them that opportunity, and that's when I look at the leadership. I look at the passion and the will to come from the rep, and if they show that, and if the leader is able to work with them on the areas of opportunity, then you can shore that gap up fairly quickly. If you don't have the will and the skill, what I've seen is that it just does not ever get there, and you end up finding that the manager or teammates are more passionate about your career than that individual. So at that point, it's pretty well obvious that you don't want to spend too much time. You've done everything that you possibly can. So it's a multifaceted group effort, I would say, to be able to make that assessment.
When you think about that median performer, because by definition that's presumably half of the group, right. That median performer who's got enough passion and has the skill and capabilities, given all the change that's happened in the market in the past 5 years, what's the biggest barrier for them to overcome? What's the biggest challenge for that motivated and capable salesperson?
The one big thing that I've seen between, I would say, middle and top tier reps is getting beyond just the relationship building, taking it a step further, understanding that I'm building a relationship. I love calling on you, but we need to get you here because this is the problem, and you're not even seeing it maybe. With sometimes your median reps will take it to the relationship. I call those the they love me calls. You say, oh, this doc, they love me, let's go see them. And you walk in there and they have access everywhere. Then you come out, you say, well, why do you only have 3% share? They love you, then okay, let's help them. Right. So I think that's part of it, just not being able to get past that relationship building aspect of things. And I think the other thing is just being able to be a bit more of a long-term strategic thinker. So as you're starting to pick up the information throughout, the account, here, here, and here, you're starting to put a puzzle together, right? You're kind of gathering intelligence. But you start to see, okay, here's the gap for this organization. You start to make connections around that. And then what can you do as a salesperson and the tools that we have to be able to help in that area? That's something that you typically will not see sometimes in that median performer. You'll see them revert back to, okay, so you have an inefficiency problem. Well, let's load some software. Well, okay. What does that do for me? Right. Is it one more thing that I have to manage now? Is it one more thing that workflow that I got to manage into? Whereas a top rep will say, we need to do this and here's the outcome and here's why. Right. Do you realize what you're losing here?
It sounds almost like the difference between an advisory relationship as opposed to a social relationship.
Yeah, I think there's an interesting point about relationships. I think relationships are important.
Oh,
right?
Certainly.
But what we've found over time, and a point of view that I like to talk about is relationships are important. Relationships built on value are the strongest relationships, right? So if you're able to demonstrate that value on a continual basis, then that's going to be the strongest relationship. That social relationship, what'd you say? They love me rep. Yeah, they love me rep. They love me. That's not a sustainable competitive advantage because the next day somebody's going to come in and deliver value in today's healthcare marketplace that goes beyond that, right? So it's understanding, back to what you're saying earlier, understanding the organization, what they have to deliver to help them achieve their outcomes. And it's not just here are the features, functions, and benefits.
Exactly. Yeah. As a sales leader, if you're not in tune with where the market is going and you're not thinking about the competencies in your organization and do they match up, are you heading in the right direction, you need to get on that post haste, because what you're going to find is that the market's going to shift and you're going to get left behind, and then you're scrambling. You're trying to figure out the competencies, you're trying to hire them in, you're trying to do all these other things, whereas it's not that easy. When you transform a sales force to adapt to where things are today and where they're headed, you don't just hire that in. You have to change how you hire. You have to change how you train. You have to change how you compensate people. I mean, the whole structure behind the sales person has to change. And so I think if I could just leave some advice would be, take some time to sit back. We're all sales leaders, we're all busy, but take some time to sit back and really think about that and think about, do you have the right team?
What's more important? Is it adapting to the new realities of being aware of what's changing in the marketplace to be able to apply that knowledge? Or is it actually a changing competency? Is it knowledge or competency, or is it both?
I would argue that it's both.
I would agree.
And you know, you could look at it at different levels. So my expectation of myself and my leaders is to be able to understand where the market's going and some of the, you know, legislation that's coming down the pipe, right? That you just described. Okay, so what's that going to do to my business? Not only my business, what's that going to do to my customers? You know, how's that going to impact them and the patients and all of that? So, you know, I feel like that's on us. Now, you have your top reps; they're also going to be on it too. A lot of times, they're emailing me and they're saying, "Have you seen this? Here's my thought, you know, on that." But you also have to have the competency as well, because if you say, "Hey, we're right here, right now, but here's where we're shifting to," you need to have that type of sales force that can go from here to here, because, you know, just like we described, right? Just a couple of years ago, we were doing features and benefits, and now all of a sudden we're talking about, you know, your average pharma and medical rep having to be a B2B, you know, mindset.
Right.
So, gosh, 10 years from now, what's it going to be? You know, if you have an agile, you know, competent, passionate sales team, then you're more likely to be successful than if you just stick with what you're doing because it's what you know or what you're comfortable with or whatever, or you're not even looking at it. You're going to get left behind, in my opinion.
I love that way of thinking about structuring that team and the investment that you're making into it. So,
one way that organizations will figure out what they need is to ask their field management team and kind of survey the grounds and say, okay, what do we need, right? And I would argue that is the way things used to be. But now, because of the investment that it takes and because of the transformation, the time and energy and resources that it takes to make that transformation, that you have to be a little more definitive. And you have to have some data to back up why you're changing and why you're trying to transform the sales force and why you're focusing on specific competencies, right? Why you're able to tell your training department, okay, these are the 3 strategic competencies that we're going to focus on, right? Because we understand that these are the ones that we believe will most impact our outcome, the outcome we're looking for. So I think in today's world, you have to be a little more definitive with your direction as opposed to surveying the field, so to speak.
more evidence to support what you're doing.
Sure. I mean, you know, the experience that I went through with that is, you're exactly right. You know, I could sit there with my team and say, so what do we need to do? What do we need to change? And we'll come up with some great ideas. Right. But are we looking through the right lens? You know, are we really thinking about, you know, the full picture of what needs to, what is happening? You know, probably not. And so when I made the decision to start to transform the sales team, I actually brought in a behavior scientist to come and look at the top reps and I didn't want to make the assumption. I could say, you know, hey, you know, Johnny, he's top rep because of this, this, and that. Well, that's Jay's opinion. Right. You know, I didn't want opinion going into this because you're talking about people's lives and your business. And so I actually brought this person in. They did segmentation for us before in marketing, and they were able to segment my top people and and kind of map out that DNA and what it looks like to hire that person, to train that person, to, you know, is it reimbursement? You know, not all of them are driven by money, classical sales, right? Pay them more, they'll, you know, we'll do a spiff, right? They'll hit that number. You know, these folks, you know, they want experiences. You know, money's great. Yeah. They have families, but they want experiences as well. And so all of this stuff, we would have missed that had we not taken that extra step to really understand the DNA of our salespeople and our sales team, and then relate that to the competencies that we would need in order to continue to be successful.
And did they also exhibit that shift innately to that B2B type?
They have.
Mentality, I guess.
And when we hire people, you know, we're looking for that. We're looking for certain attributes. It's interesting, you know, a lot of them were, you know, football players. You know, a lot of them were athletes. You know, and you know, team captains. So one of my top people was a NCAA championship running, team leader. And, so there's a certain level of leadership, there, and passion and drive and followership and everything else that goes along with that. But, that's just one of the things that we learned. I never would have looked for that. I would have been looking for the classic 6 years of sales experience, You got the, the great brag book that comes in. I don't really look for that anymore.
Well, Jay Graves, Brad Ansley, thank you so much for joining the Business of Healthcare.
It's been a pleasure.
Thank you so much. Appreciate it.
Thank you for joining the Business of Healthcare today. Visit us at www.bohseries.com or search for Business of Healthcare wherever you listen to podcasts. TJ Ingragia was our videographer, Nat Sharp was our production assistant, Amy Lamb was our research assistant. I'm Matthew Hanis, founder and executive producer of the Business of Healthcare.